The American Medical Association today called on public officials to abstain from using racially charged language which associates the virus with geography or populations of people. The AMA says that language such as the Wuhan virus or the Chinese coronavirus and similar variations serve no legitimate purpose whatsoever and, furthermore, is inappropriate. And join us now to discuss is American Medical Association Director, Dr. Patrice Harris. I'm sorry. Thank you so much for joining us.
Thank you for having me back, Fred.
And can you tell me, has this kind of behavior ramped up in recent days?
Well, Fred, there's a theme here, right, in the stories that you just showed. And so we have been hearing actually from our Asian American colleagues, our Asian presenting colleagues, that there had been an increase in the use of racist and bigoted language, and also using the term the Chinese virus or the Wuhan virus. And so that is why in a statement that we put out, we certainly condemned the xenophobic or racist behavior across the board, but certainly we've been seeing that increase as it relates to the current pandemic.
And not only just for everyday folks, but for physicians and nurses of Asian descent as well. Is that correct?
Absolutely. We had been hearing those stories and stories of patients not wanting to be treated by our colleagues of Asian descent, saying go back to China, or, threatening them again using racist, bigoted language. And so, certainly at the AMA, we realize the impact of racism and biased behavior on the health outcomes of our patients. And so we always take an opportunity to call out any behavior, and we wanted to make sure we called out this, again, racist and xenophobic language. It has no place in our society, and certainly as it relates to health, it can lead to poor health outcomes.
And Dr. Harris, we would all like to think that COVID-19, this level of tragedy, 100,000 lives are going to be lost before too long and counting. You would like to think it brings out the best in people, and it does in many different ways. But it also brings out the worst in people, doesn't it?
Well, I think you're right. And I think we should say for the most part, it is bringing out the best in people. But, and I have to say, and I'm a psychiatrist, and I know that there's uncertainty and worry, and a lot of times when people are worried or afraid, they may resort to, as you say, the worst in us, and certainly those of us who are committed to the best in us will have to continue to be models and again call out these inappropriate behaviors. We have to make that agreement when we see them and hear them.
And let me ask your professional and clinical opinion on where we stand right now in the battle against COVID-19. It's blood-curdling almost to see what happened in certain places over the Memorial Day weekend, where people were just gathered and no masking and no social distancing whatsoever, as if the virus has gone away. What are you doing to try to educate people that, listen, we're not even close to being done with this thing yet?
Starting with the speech I gave maybe about 6 weeks ago now, with a plea actually for everyone to stay focused on the science and the evidence and the data, and to put patients and the health of the public above politics. We've been working really hard at the AMA to be a credible, trusted source of information so that folks know they can come to us. We know it's a lot of information and sometimes confusing. So we've been working very hard to make sure that we present as a credible source of trusted information, and we will continue to do so. It was difficult this weekend. Certainly, we know that we are about, as you note, to hit a very grim milestone. And while in some areas their cases are steady or decreasing, we know that in other areas it's increasing. And if we relax, if we let down our guard too soon, we risk a spike, not just a wave, but a spike in cases that again may overwhelm health systems. Maybe not in the big cities, but what about in the rural areas? So I just encourage everyone to continue those tried and true public health practices. Yes, it's okay to go out, assess your risk. Again, stay 6 feet apart or more if you can. Outside is better than inside, as limited close contact as possible. Again, if we continue to do this work, we can continue to limit the spread of the disease.
All right, she is Dr. Patrice Harris, the president of the AMA. Thank you so much for joining me again, and you always have a platform here anytime.
Thank you very much.